My name is Dr. Leonard Dechi, Head of Department, Pathology, School of Medical Sciences. See, as WHO has declared, as part of the Sustainable Healthcare Development, we are thinking about universal healthcare to all the population in the world. And as physician assistants celebrating their week, they wanted to know their role and their career advancement. There are a lot of physician assistantship programs coming up in this country, but it looks like most of the students who goes through this program don't know the way forward. And we are talking about the fact that if the nation will come together and develop a comprehensive policy of healthcare professionals, the physician assistant can be the center stage of achieving these universal healthcare goals. Why do I say that? See, it takes a shorter time to train a physician assistant compared to training a medical officer. On an average, it takes 6 years to train a medical officer to become a general practitioner. Even after the 6 years, you have to do 2-year housemanship. It takes 4 years to train a physician assistant, and then 1 year internship to practice medicine. For the medical officer, they will have to specialize, and that will take on an average around 5 years. But currently, there is no specialization program for physician assistant, who are the forerunners of preventive health care. So as a country, we need to stimulate the debate and talk about how we can develop specialization programs for the physician assistant study. And I will want to propose that as a matter of urgency, the Ministry of Health should look at this problem. You see, currently, the physician assistants and the medical officers are being regulated by the same body, which is the Ghana Medical and Dental Council. So what will prevent the Ministry of Health to also tell Ghana College of Physicians and Surgeons to look at developing specialization program within the different areas of medicine, to start training physician assistants to also have specialization programs? We can come up with associate membership programs. You see, when you take the Ghana College of Physicians and Surgeons, they have a 2-tier where you have the members who are specialists, and then you have the fellows who can be appointed as consultants. We can develop a program called an associate membership for physician assistant who can also be specialists in the physician assistant program in medicine. So let's take, if you take, say, Upper West, and you have no cardiologist in the whole of Upper West, if you train a physician assistant in area of cardiology and the person is posted to Upper West, most of the cardiovascular cases that are within the reach of his knowledge can be handled, so that they will not end up being referred to Tamale, if in case, assuming Tamale has a cardiologist, which I don't even know for now. But if there is no cardiologist in Tamale, then the person has to be referred to Kumasi Konfanochi Teaching Hospital. But then if we are going to look at developing this universal healthcare system, these physician assistants who possess the knowledge and can easily be trained to handle some of these specialties to that level can help in achieving these equalities in the healthcare system. Most of the students have not imbibed in the concept of physician assistantship studies. They see it as a means to an end. Why do I say so? Most of them wanted to go to medical school, and they didn't get the opportunity to go to medical school because of the limited numbers of medical schools in the country. Not because they are not intelligent, but because the country has failed the younger generation, and most of them cannot be trained. Because you go to a class and you can even have somebody with aggregate 6, but because of lack of space, couldn't get into medical school, so ended up in physician assistantship studies. And because currently there are no specialization program, the person sits in the class and think that to be successful as a healthcare professional, I need to finish medical school. I need to finish physician assistantship studies and go back to medical school. I'm challenging all of us that we need to start developing specialization program for this cadre of healthcare professionals. Once it is done, people will not waste the taxpayers' money to finish physician assistantship studies and go back to medical school. They will know that they are a professional of their own right who have a career development which is ahead of them, and they can go into those career development and have job satisfaction. Once we do that as a country, we will have people being satisfied with the chosen profession, and they will not look at physician assistantship studies as a stopgap measure.